you know, we don't have any secrets here on San Diego Living. We're all family. So I can tell you that about 10 years ago, I had a heart catheterization. And thankfully, it all turned out fine. There was no problems. And we were able to see that all my arteries were very clear. Well, flash forward about 10 years, and when we tell you what's going on at Alvarado Hospital, it is nothing short of amazing how far the technology has come since then. Dr. Michalski is here this morning from Alvarado Hospital to talk about your new Cath lab at Alvarado. Now, am I overstating the case, or have we really come that far in 10 years?
Every 5 or 10 years, the equipment takes a bit of a leap. And these pieces of equipment are very expensive, and it's a huge endeavor for a system to make these improvements, but it's very important for patient care. And we've been able to do that for many reasons. Naturally, the equipment does age after a while. Alvarado's been on the cutting edge of providing cardiac care for a long time. We did the first heart bypass surgery in San Diego.
Folks probably don't even realize that.
No.
The very first bypass surgery done at Alvarado. The cath labs, though, not every hospital can even afford this equipment because, like you say, it is very expensive. So you don't find this at every facility, do you?
You don't. I'd say about half the hospitals in San Diego have this capability. And of those, only some have interventional cardiologists on board, like myself, people who can take care of a heart attack. I think there's 7 or 8 places in town that do that.
Well, again, mine was for my heart. And, you know, I laid there on the table, and they went up through the leg with the catheter and into the heart, shot some dye in there.
Right.
And I was conscious during the whole thing, looking at it, going, wow, that's amazing. But you say you can see so much more now, and it's not just for the heart. I thought it was just exclusively for the heart.
Right. The term angiogram literally means angio is blood vessel, gram, picture. So we're taking a picture of a blood vessel. Most people think of that in terms of the heart because a heart artery provides blood to the most important pumping organ.
Right.
It takes a lot of energy and you can't live without it. But you can develop this disease, atherosclerosis, in any blood vessel in your body. You could get it in your carotid arteries, in your neck, and that could predispose you to stroke. You could get it in your legs. People have heard of PAD, peripheral artery disease, where that might cause cramping or pain in the legs when walking. So we can actually look at all of those with our new lab. Most labs were built just to look at the heart, but we've installed a system that can look just about anywhere in your body and see things with much greater clarity than we could have last week.
See, now in my case, there was nothing wrong, and I was so relieved to find that out. It was a wonderful bit of information to have. There's really no other way to know 100% what's going on in the arteries without going in there and taking a look, is there?
It's the gold standard way. Not everyone needs that. For instance, if someone came to me and said, hey, I'm just wondering if I've got blockages, can we do an angiogram? I'd say, no, maybe we should do a treadmill test or something else.
Well, I had that first, and it showed a little bit of an irregular heartbeat. And with an abundance of caution, my cardiologist said, let's go in and take a look.
Right, and we're developing new ways to look non-invasively too. For instance, Alvarado Hospital just installed a 64-slice CT scanner, which can get some ideas about blood vessels non-invasively. But if you're having symptoms or one of these non-invasive tests is abnormal, or God forbid you're having a heart attack, then you need that invasive test, and it's great to have a state-of-the-art facility to do that work in.
So if you do go to Alvarado, this again could be utilized after a consultation with your doctor, or right up to the point where you're actually in a medical emergency.
Yeah, I'd say about 1/3 of our procedures are emergent. Patients come into the emergency room saying, I was fine yesterday and now I'm having pain in my chest. What's going on?
It's just utterly amazing. And again, we've had up on the screen here most of the time some of the benefits of that. Less exposure to x-rays.
About half, yeah.
Yeah, about half. So that's a consideration for a lot of folks, especially if you've had multiple medical procedures.
It is, and to take these pictures we also have to inject a small amount of dye or contrast, and for certain patients that can be hard on their kidneys, and we're able to do this procedure with a lot less of that dye because of the technologically superior equipment that we have, so we can do it more safely for those patients as well.
Fantastic. Dr. Michalski from Alvarado Hospital, thank you so much. I had a bit of other surgery there a while back, and you folks treated me great, too.
We try to provide a step above.
Yeah, well, you absolutely did. So thank you again very, very much. My family thanks you as well. All right, let's get back out to Ruben now. Oh, for more information, of course, as always, go to san diego6.com and check it out there and find out what Alvarado has to offer.